Hello everyone, this is Dr. Manpreet Khurana, and today the topic is mechanism of action of aspirin, which is an anti-platelet drug. Now, to understand the mechanism of action of aspirin, we can see that whenever there is an injury to a vessel, the membrane phospholipids gives rise to arachidonic acid. How this happens is there are various phospholipases which act on this membrane phospholipids and they give rise to arachidonic acid. Now, if we see there is a flow chart at the bottom, and here we can understand that what happens with this arachidonic acid. Now, the arachidonic acid is governed by two pathways, which are known as cyclooxygenase enzymes. Now, these cyclooxygenase enzymes can be divided into COX-1 and COX-2. That is cyclooxygenase 1 and cyclooxygenase 2. Now, the cyclooxygenase 1 enzyme is a constitutive enzyme, which means it is mainly dependent on the physiological action, the normal physiological pathways. During the normal physiological processes, the COX-1 comes into place, which gives rise to the prostaglandin PGH2. Whereas in the case of COX-2, it mainly occurs or it is mainly active in the cases of chronic diseases and in the cases of inflammation. Now, if we take a look at COX-1, this PGH2 gives rise to thromboxane A2, prostacyclin PGI2, and PGE2. Now, the actions, what are the various actions of these prostaglandins and thromboxanes and prostacyclins? This thromboxane A2 is a type of platelet aggregation, which helps in the formation of platelet plugs. So we can say that the platelet plug is formed with the action of thromboxane A2, which helps in the platelet aggregation. The platelets aggregate. Now, what happens is the action of aspirin is inhibitory on COX-1 and COX-2. So it inhibits both the enzymes, that is COX-1 and COX-2, due to which all the prostaglandins and prostacyclins are inhibited. So we can say the PGH2 is decreased, inhibited, the thromboxane A2 is inhibited, PGI2 is inhibited, PGE2 is inhibited. Here again, with COX-2, PGE2 is inhibited, pro-inflammatory prostaglandins are inhibited, and PGI2 is inhibited. Now, let's see what are the various functions which are inhibited by aspirin. Now, the platelet aggregation is inhibited, which is due to which the platelet plug is not formed and the clot is not formed eventually, right? The prostaglandin I2 has an effect on gastrointestinal tract. Now, when this is inhibited, it gives rise to GI ulcers. Inhibition of PGE2 in both COX-1 and COX-2 pathways decreases the renal function. So it has a negative effect on the kidney. Now, if you see with the COX-2, there are some pro-inflammatory prostaglandins, which are involved with pain, fever, and inflammation. So when it is inhibited, the pain is decreased, fever is decreased, and inflammation is decreased. These are the useful effects. These are the required effects of aspirin, right? Now, after that, we have the prostaglandin I2, which is involved with vasodilation and thromboxane A2. So you will see that the COX-2 has a different or opposite role through this thromboxane A2. So technically it decreases thromboxane A2. So these are the various effects of aspirin and how the aspirin acts on the cyclooxygenase pathway and what is actually the cyclooxygenase pathway. So this we have seen. Thank you and have a nice day.